Hello everyone, good afternoon. So myself, Dr. Ridyam Devan. I am a DNB General Medicine resident at SL Reja Hospital. And today our topic of discussion is the common illnesses that we see during monsoons. So let me introduce our medical expert that we have with us today. He is Dr. Paritosh Baghel. Dr. Paritosh Baghel is a senior consultant physician at SL Reja Hospital in Mumbai with over 20 years of experience in the field of internal medicine. He has previously served as professor of medicine and head of the medicine unit at Grant Medical College and Sir JJ Group of Hospitals, Mumbai. He has completed his MBBS from JJ Hospital and earned his MD in internal medicine from KEM Hospital. He is recognized for his clinical expertise in managing infectious diseases and chronic lifestyle conditions such as diabetes, hypertension, and cardiovascular disorders. And also during the COVID 19 pandemic, he led the hospital's COVID unit and successfully managed nearly 5,000 patients. Apart from this, he is certified by the American Heart Association as a trainer in basic and advanced cardiac life support. And he is actively involved in the academic research with numerous national and international publications and regular speaking engagements at medical conferences. He also holds an LLB from Mumbai University and yes, good afternoon, sir. Thank you so much for joining with us.
Thank you, Dr. Ridham. Thank you for the wonderful and the kind, introduction. Let us start.
Yes, sir. So, sir, as the monsoon season is in full swing, so according to you, what are the common illnesses that all the viewers should know, and what are the just please walk us through and guide us.
Yeah. So, very importantly, yes, monsoons are going on, and we all feel very happy during the monsoons. But at the same time, one should understand that monsoon, along with the happiness, there are a lot of diseases which are commonly seen during this period. And when we classify these diseases or the kind of diseases which we see during monsoons, mainly they can be classified into four groups. One is airborne infections, where the infection is spread through air. A person can get infection through coughing or sneezing of an infected individual. So there are airborne infections. The second class of infections which we get in monsoons is waterborne infections. Waterborne means those infections which are spread through contaminated food and water. Third class of group of infections which we see during monsoons are vector-borne. So when I mean vector-borne, means those infections which are spread through vectors, and important vectors which are seen during monsoons are mosquitoes, flies, and mosquitoes are important because they spread very dangerous diseases. And the fourth group of infections which we see during monsoons are the skin and soft tissue infections, which are common because of the humidity. So generally fungal infections or some bacterial infections which are common during this season. So these are some of the infections which are commonly seen during monsoons.
Right, sir. So, sir, according to you, which are the more commonly seen illnesses? Because the
Among
viewers,
these,
yeah, absolutely.
yeah.
So,
So, Dr. Ridham, what I see is the most commonest form of infections during monsoons is because of the humidity and the dip in the temperature. So the commonest infections are generally the respiratory ones, which are airborne. So the viral infections, flu, common cold, these are the most common infections. But having said that, it doesn't mean that the other infections are not so very common. But yes, respiratory infections are the most common infections in monsoon.
respiratory infections, right, sir. So, could you please elaborate more on airborne diseases, like how do they spread, and what are the common symptoms, and what should people keep in mind while thinking
Yeah.
of airborne diseases?
Yeah, so airborne infections are those infections which are spread through air. Means if a person has got an infection, if he coughs and sneezes, that leads to spread of that virus. And any person who comes in contact with a close contact with a person who's coughing or sneezing, then you are also bound to get that infection. So generally हवा से जो फैलता है infection हवा के माध्यम से, उसको हम airborne infections बोलते हैं. And the common infections which are spread through this route are respiratory infections. So as you can see, cough, sneezing, जब भी respiratory infection होता है, मतलब lungs में या chest में या upper respiratory tract जैसे nose या throat infections, ये सारे infections are airborne infections, and they are mainly caused by viruses. Very common infections are viral infections, and they can be common cold, which anybody can get anytime, but the incidence increases during monsoons. So common cold के symptoms जैसे हैं nose, flowy nose, runny nose, blocked nose, chest congestion in the throat, a cough which may be productive or may be dry, headache because of acute blocking of the sinuses. These are some of the symptoms, and along with that, one can get fever. So these are the common symptoms of these respiratory or viral infections.
Right.
You can get a bacterial chest infection also, but that is not very common. It may be a secondary bacterial infection after you get a viral infection, and if it is not treated well. So these are the common symptoms. What one should do if you get these kind of symptoms, then one should immediately isolate himself so that you do not spread the infection. Take care of your cough and sneeze, cover your nose, cover your cough. That is very important. Take rest, avoid cold food items. That is what we do. Now the common infections, if I were to tell you, is common cold, which is very common and which is with viruses like rhinovirus. Generally it resolves on its own. It takes 3-4 days to get better, but certain group of populations like elderly or very young or those who are immunocompromised, मतलब जिनको diabetes, blood pressure या underlying कोई morbid conditions है, they can get a prolonged infection and they may take some time to recover, or the infection can become severe. Another group of infections which are respiratory or airborne are like flu viruses, which are very common. So flu viruses is caused by the influenza virus, and it can lead to serious infections in elderly and in younger population and in people who are immunocompromised. So symptoms are same. If you get these symptoms, you should immediately take precautions to prevent the spread. Start treatment. Do home based therapies which you can do, like avoiding cold water or cold things. Have some warm water. Do gargles. All those things which you can do. But if the symptoms are not resolving, then it is best to seek a medical care, meet a doctor, so that you can take early treatment, especially those people, those who are immunocompromised, those who have got diabetes, heart disease, kidney disease, or those who are at the extremes of the age.
Right, sir. Thank you so much, sir. And so, in these monsoon season, we know there's a high chance of water contamination also. So, sir, could you elaborate more on waterborne diseases, like how do they spread and what precautions should we take to save ourselves?
Yeah, so the second group of diseases which are commonly seen in monsoons are waterborne diseases. As we know, there's the rains, especially in Mumbai, are incessant. There is flooding in areas. At the same time, the level of hygiene also goes down during this season. So there are chances that the water which we drink or which we, the food which we eat, there are high chances that it will become contaminated. Contaminated means it can become unhealthy to eat, to drink or eat. So especially people who eat outside during this season, outside food which is not properly cooked, there are high chances that you may get an infection by this route. सो जो इन्फेक्शन खाने पीने से, स्पेशली कंटेमिनेटेड पानी पीने से या कुछ खाने से जब होता है, तो उसे हम वाटर बोर्न इन्फेक्शन बोलते हैं. और इस क्लास ऑफ डिजीजेज में ये जो ग्रुप है, इसमें जो कॉमन डिजीजेज हैं वो वेरी कॉमन जो हम देखते हैं उसमें टाइफाइड है, जिसको वेंट्रिक फीवर बोलते हैं. इट्स अ टाइफाइड इन्फेक्शन विच इज़ वेरी वेरी कॉमन, and it is a pretty significant and a serious disease if it is not treated well. दूसरा जो इन्फेक्शन जो हमें देखने में आता है वो है कोलेरा, which is not so very common. It is very easily identifiable by the symptoms. तीसरा इन्फेक्शन जो हमको दिखता है वो है जॉन्डिस, जो कि हेपेटाइटिस की वजह से हो सकता है, स्पेशली हेपेटाइटिस ए और ई, because hepatitis B or C are not through food and water, they are spread through blood. So hepatitis A or hepatitis E are waterborne diseases, and that causes jaundice. And another infection which we see is GI infections, which is called as diarrhea or loose motions which people get. So diarrhea, dysentery, that can be because of viruses, that can be because of bacteria. And another infection which can be waterborne or which is water related, although there is a vector involved into it, but it is water related, which is leptospirosis. Mumbai has seen the epidemic of leptospirosis in 2005 2006. So these are the waterborne infections, means these are spread through water, through contaminated water and food.
Right, sir. So just one doubt, sir, from a layman's perspective. So if somebody is getting fever and is getting diarrhea and abdominal pain, should one get tested for these diseases, or should one just continue with home care and ORS, or wait and
Yeah.
watch? What
Very
should
good question. Very good question. So this is a very common symptom during monsoons where the presentation, how will the patient present with a waterborne infection? Generally, it is an infection of the gut, of the intestines. So most of these infections like diarrhea हुआ या फिर आपका typhoid हुआ या cholera हुआ, ये सारे के सारे these are gut infections. So the when you consume that contaminated food and water, the bacteria, the organism gains entry into into our intestines and our gut, and there it develops and starts giving us the infection. So what are the presenting symptoms? How does one get to know that he has got a infection which is waterborne? Basically the presentation is that patient will get fever, you will get fever, you will get loose motions, diarrhea. Again, typhoid can present with diarrhea, but again, fever is the most important presenting symptom of typhoid. Cholera, severe diarrhea which is watery, rice water like, and the patient has to be immediately treated, and it is a highly infectious disease. So one has to be very careful. If you get diarrhea, it has to be treated urgently, otherwise there is a chance of death with cholera. Other infections like diarrhea, they can cause lot of water loss, and that can lead to deterioration in the health. So identification, if you get loose motions and if they are not getting better, then you
Right.
have to immediately seek medical care. What things which you can do when you get these kind of symptoms is to hydrate yourself. The most important cause of complication with these infections, generally जो पेट के infections हैं, डायरिया है, उसका वाटर लॉस होने की वजह से है, और उसकी वजह से ब्लड प्रेशर लो हो सकता है, उसकी वजह से आपकी किडनी पे असर हो सकता है. सो दीज थिंग्स नीड वाटर रिहाइड्रेशन. सो दैट्स वाई WHO ORS जो हमारे अवेलेबल है, ओरल रिहाइड्रेशन सोल्यूशन, एंड वाटर इनटेक की मात्रा अच्छी से रखनी है, ORS का कंजम्पशन करना है. और इसके बावजूद भी यदि फीवर नहीं जा रहा है, एंड इफ इन लूज मोशंस आर नॉट सेटलिंग, then one should seek medical care, especially treatment with antibiotics, IV fluids will be required. One important point which I would like to tell my viewers is, many a times we see that patient क्या करते हैं जिनको ये होता है, they take some medicine which will stop the loose motions, like they take Rocco, or they take some medication which will prevent the loose motions or stop the loose motions. But that is not the treatment. That is only a temporary measure to hold the infection and to hold the diarrhea, but that is not the treatment. So you should not be taking those medications without an advice. If very severe, where you want to stop the diarrhea, you are traveling somewhere and you are not able to hold back your emotions, then SOS, yes, but seek medical care if things are not resolved. That is a very important thing. Drink good amount of water. पानी का intake करना, ORS solution शुरू करना is the initial treatment which anybody should do. At the same time, I would like to give a word of caution to those patients who have got diabetes or who have got heart disease, जिनको fluid restriction है, जिनके ऊपर शुगर लेने का बंदी है. तो in those patients, I would advise कि in case if they get these kind of symptoms, they should speak to their doctor and talk to them so that they can get appropriate treatment. Otherwise, they will land up into other complications because of excess consumption of water, excess consumption of sugar.
Thank you so much, sir. That was really informative, and I'm sure not many of them knew about this, because even I knew some of things that I did not know. Right, sir. So, as we know that in monsoon there is a rise in malaria and dengue. So, what are these vectors, and what are vector-borne diseases, sir? Please
Yeah.
enlighten.
So as like how there is a spread of infections by water, contaminated water, similarly there is a surge of infections which happens during monsoons, and that is because of the presence of these vectors, which we call in our medical terminology as vectors. Basically, vectors का मतलब है कि those agents which spread the disease. So these are live, or they can be non-living as well. But very common are these living organisms which spread the disease from one person to another. And these vectors means a very good example is mosquitoes, flies, cockroaches, and all those things. So mosquitoes play a very important role of these vector-borne diseases, and they spread to very serious disease called malaria, dengue, chikungunya, and all these infections are spread by a vector which is the mosquito. एंड क्या होता है मानसून्स के दौरान, देर इज अ लॉट ऑफ स्टैग्नेशन ऑफ वाटर, देर इज एक्यूमुलेशन ऑफ वाटर एट वेरियस प्लेसेस, सो इट बिकम्स अ ब्रीडिंग ग्राउंड फॉर दिस मॉस्किटोज. and when they breed, and they can carry these organisms, these dangerous organisms, the malaria parasite or the dengue virus, they can carry, and when they bite a person, they can spread this disease from one person to another. That is the meaning of vector borne diseases. So vector borne diseases के लिए खासकर important है mosquito. And as let me tell you, malaria is a very serious disease. Dengue itself is a serious disease. That in case if you get these kind of symptoms, if you had a history of mosquito bite, or in case symptoms क्या है, basically you will start with fever, ठंडी लग के बुखार आना. So in case if you're getting fever with chills, and there is an area where you know that there are mosquitoes, you are living in that area, or you have traveled to your area where mosquito bites have happened or they are common, या आपके एरिया में कई लोगों को मलेरिया हो रहा है, आपके आजू बाजू में अगल बगल में किसी को अगर मलेरिया हो रहा है, सो वेरी लाइकलीहुड कि अगर आपको मस्कीटो ने बाइट किया है और उसके बाद में आपको फीवर और ठंडी लग के बुखार आने लगे, बॉडी एक हेडेक होने लगे, तो फिर डेफिनेटली यू शुड टेस्ट योरसेल्फ for these vector-borne infections, and you should treat it. Now, important symptom which you can get with malaria is fever, and another important symptom which you can get with malaria is it appears as if the bones are being broken. So headache, backache, retroorbital pain, lower back pain, joint pain, very likelihood that this could be dengue along with fever. Similarly, one more infection which is vector borne is chikungunya, and that is also spread by the same mosquito which causes dengue. So here the symptoms are same like fever, but more symptoms are associated with joint pain. There will be multiple symmetrical joint pains. सब जगह joint pain होएगा, fever होएगा. Although chikungunya is not as serious a disease like malaria and dengue, death is not reported with chikungunya, but yes, it is a debilitating disease, क्योंकि कई बार joint pain की वजह से लोगों को 6-6 महीने तक joint pain होते रहता है, and they are not able or fit to do their work. So these are some of the symptoms, and these are the symptoms of these vector-borne diseases, especially caused by mosquito.
Right, sir. So there's one more question, sir, which is not. Hello.
Diagnose it.
Am I audible?
Yes.
Yeah. So, sir, there's one more question that is not very commonly discussed in these monsoon season. That is the skin infections. Like,
Yeah.
how to differentiate between different skin infections, how to differentiate between blisters, rashes, and when to seek medical care.
Yeah. So one point before I go to skin infections, I would like to tell you that it's a very simple way to detect these infections like malaria and dengue. A simple blood test can identify the malarial infection or a dengue infection, which can be a rapid diagnostic way to identify whether you have got this disease. Now coming to your question for skin infections, very common during monsoons, increase in humidity, humidity rise, dip in temperature, all that leads to skin infections, especially those areas where there is friction, groins, underarms. These are the places where you can get infections because the clothes remain wet. There's a lot of humidity, and these skin infections are mainly of two different types which you can classify. You can get a fungal infection where they are generally at the sites of friction, and they are associated with itching, or there will be a rash which would be either a raised rash with itching, redness, or a spreading rash over the body. That can identify that this is a fungal infection. You can also get bacterial infections. For example, if there is a cut on the skin and you have waded through the water, or because of the wetness and dampness in between the toes, you can get a bacterial infection also. Especially जिनको diabetes है, उनको ये bacterial infection होने के बहुत chances है. Fungal infections are also common. The main identification is by looking at the lesion. Show it to a doctor so that he can identify that this is a fungal infection or a bacterial infection. Don't apply creams rampantly, because it may happen that it is a fungal infection, and if you apply a cream which contains some steroids or something, it will flare up the disease. So show the infection, show the lesion which is there to a doctor so that he can very well classify whether it is a fungal or a bacterial infection and accordingly treat it.
Right, sir. Thank you so much, sir. And just one last question. How to prevent and how to stay safe from these diseases, sir?
Yeah, so now we have covered that what are the symptoms and what one should do. The most important aspect in any disease management, Well, I tell my patients ki disease is always, treatment is always costly, but prevention is very cheap. So, and prevention is the key for remaining healthy. So basically for prevention, one has to identify किस तरीके से वो disease spread होता है. If it is an airborne infection, then you have to take precautions so that you don't spread the disease through air. So, for example, if you get a common cold or cough, make sure that you remain isolated. You don't go to crowded places. Take a break from your job. Wear a mask. Cover your nose and mouth while coughing, and take the treatment appropriately. Second thing is to maintain a good hygiene. Wash your hands. It may happen that you have sneezed and you have put your hand on it, and when you touch some knobs or door handles or anything, and somebody else touches those knobs and handles, and he touches his face back, then the virus can remain alive for some time on those knobs, and which can be a way of spread of these infections. So wash your hands, cover your nose and mouth. If you are sick, avoid crowded places, avoid your workplace, stay isolated. This is very important. Second is boost your immunity. Boosting your immunity in terms means have good amount of water, have nutritious food, properly cooked food, well nutritious balanced diet will improve your immunity and prevent you from these viral infections. For waterborne infections, again the same principle of good sanitation, hand hygiene. Don't eat uncooked food. If you are very hungry, you want to eat outside, make sure that you eat a cooked food. Don't use the utensils which are outside, may not be washed properly, may not be cleaned properly. That may be a source of infection. If you want to eat some fruits, preferably eat peeled fruits, unpeeled fruits, so that you can peel and the fruit is intact. I see people eating those fruits which are cut open where there are flies sitting on them, and that is a very common source of infection. So maintain a personal hygiene, maintain a food hygiene, wash your hands, eat the right food, avoid uncooked food, especially salads, fruits, and everything which are cut and kept in open. For vector-borne diseases, the prevention is basically to prevent the bites of those mosquitoes. That is a prevention of care of biting. So using of mosquito nets in case if you are going to areas where there are mosquitoes, make sure that you wear full sleeves. Apply cream which will cause the mosquitoes to go away. These are personal protective measures, but for a community based thing, important thing is to prevent the breeding grounds of mosquitoes. Prevent stagnation of water. If there are cases of of malaria or dengue in your area, alert the authorities so that they can take care, so that the breeding of mosquitoes do not take place. For skin and soft tissue infections, again the prevention is very important. Keep yourself dry. Apply antiseptic or antifungal powders in the groins and axilla, and eat proper food, avoid dampness, and close contact with people, so then the spread of infection does not happen. These are some of the preventive measures to take care of these illnesses which are so very common in monsoon.
Right, sir. Thank you so much, sir. So I'm done with my set of questions. Just one last thing. Any take-home messages for our viewers, sir?
Yes. So the most important thing which I would like to point to all my viewers and all the listeners who are there is basically maintain. Instead of treatment, you should maintain a preventive approach to any disease. So prevention is better than cure. This is an old saying. Preventing diseases is always, as I told you, less painful, less costly, whereas treatment becomes a costly affair. Also, it is very painful. So, prevention is what you should look for. Prevent the diseases, understand how those diseases are spread, and take the measures so that they can be prevented. Block the spread of the diseases, block the airborne diseases in spread, block the vector-borne diseases, block the waterborne diseases. All these things is in our hand. Stay safe, stay healthy, eat good nutritious food so that you maintain your immunity. These are some of the takeaway messages which I would want you to give during this monsoon season. One last thing which I am forgetting, which I should not forget, is do not wade in the water which is stagnant, because there are chances when you wade through this water, then the chances of getting these infections are like leptospirosis and all that is very high. And in case if you have waded through the water, please do consult your doctor and tell in case if you get fever and all that, how that, so that you can get early treatment for these diseases.
Thank you so much, Dr. Paritosh Baghel, sir, for such a comprehensive overview on the common illnesses that we see during monsoons. and I'm sure it will be a useful guide for all our viewers, and they'll be able to enjoy monsoons with such beautiful insights. Thank you so much, sir.
Thank you
Thank
so
you.
much. Thank you, Dr. Hidayam.